Hi GP learners, welcome to our new format of the EGP Learning Podblast. We hope you've enjoyed our stuff, but we thought we'd jazz it up a little bit. So I'm Dr. Zain Gandhi, as many of you hopefully should know, EGP Learning, and you can find me on Twitter at drgandalf52.
And I'm Dr. Andy Foster at Dr. A.W. Foster on Twitter and avoidingpuddles.com on the interweb. So we've got a new format for you now. We've decided to do some shorter format episodes focusing on things that are in the news, topical issues around the health technology community and space, and also bringing you some tips, things that we've seen in the last few weeks ourselves that might be useful to share with you guys.
Definitely. And we'll also be having our more deeper dive episodes as well, spattered throughout there. And we've got some interesting stuff coming up for you shortly. Hopefully you guys enjoyed our consumer wearables episode that has been out, and we'd love to hear your comments as always on that. And as we said, you can catch us on any of our social media platforms, Twitter, Facebook, Instagram, LinkedIn, everywhere and stuff. And definitely let us know what you think of this new format in terms of the shape, the style, and hopefully the recording. We're going to see some improvement in our audio recording as well. In terms of what we're covering today, well, we wanted to cover a few different things. We've got two articles we're going to talk about. So one is...
digital first providers have been in the news recently, not in the last week, but in the last month or so. So there's a story about recommendations from NHS England about the registration of patients as it applies to digital first providers, which I think is interesting and topical. What's your story, Gandhi?
So I'm going to have a look at the CQC's report on digital provision and stuff. So it's an interesting article that came out just a couple of days ago. It talks about basically what the regulator feels about digital provision for healthcare and things.
Yeah. And then we've got some tips about things that we've seen in and around our travels on the interweb in the last few weeks. We'll bring those to you at the end.
Yeah.
So shall we dive into these news stories then, Gandhi?
Definitely. So first up, we've got this story that you mentioned about digital providers and how that's going to effectively potentially change. NHS England and all the different kind of people involved in this kind of stuff have been looking at how digital providers can give service, particularly in primary care.
Yeah, so this is a story from Pulse. It's from the 27th of September, which was a little while ago now, but it's a big story, I think, in the digital health space.
Yeah.
So NHS England have approved proposals governing digital first providers. So there's going to be some changes in terms of the registration of those patients. So I think what's prompted this is that it's a developing space. They want to encourage more digital first contacts and more digital first providers to enter the space, but there was some controversy, some interesting responses to one digital provider in London. Gandhi, do you want to? I know we've talked about the controversy around GP at hand before. Do you want to briefly explain?
Well, some of our more avid EGP learners and stuff will remember our earlier episodes where we talked about companies like Babylon and Push Doctor and that kind of stuff and things, and how that model had challenges in the way that it ran from the registration aspects and in potential impacts on local practices and stuff. And effectively, a patient could register with any practice, whether they were in the practice area or outside the practice area. That's what the current regulations allow. But that then led to problems in terms of providing care to patients that were potentially outside of a practice area and then needing to see somebody for a face-to-face. So the example could be if your practice is down in London and you live in Sheffield, you've registered with that provider down in London, and then you contact them, you get digital care, which works really, really well and effective for you. But then if you actually need to see someone, unless you plan on going down the M1 for a few hours and then a few hours back, you had a bit of an issue. And this led to increased costs for particularly CCGs where these providers were housed. And it's also an element of continuity care, I guess,
Yeah, there's all sorts of issues, but it was controversial, and that's forced really NHS England to have a think about these issues. So, down to the story. So this story talks about the response to a report that was published by NHS England, Digital First Primary Care. So it's 63 pages long, the report that it talks about.
Wow.
I've read the executive summary, and I think actually the main report does look interesting, and it might be a good topic for a future episode. In brief, once a digital first practice has registered more than 1,000 patients from another CCG area, so this is this sort of crossing boundaries issues that Gandhi was talking about. The proposal is that they'll be required to set up a new practice with physical premises in the other area where they've picked up the additional patients. And the hope is that this will enable those patients in the other CCGs to actually have access to face-to-face consultations closer to where they live, more convenient to them. There's also an issue around digital first providers being properly linked into local services and community services and referral pathways. So that's, you know, how do you refer effectively and follow the proper pathway to your local hospital, and also, you know, how do you link patients in with district nurses and kind of other local services. So the hope is that these proposals will enable patients, and it's quite patient focused, to be properly plugged into the NHS where they are, where they live, not necessarily where they're registered, although they will be registered in the new place under these plans. And that's the long and short of it, really. So this was largely a response to, well, I think this was largely a response to the waves created by Babylon's GP at hand. Babylon responded to the proposals actually quite positively. And actually, if you think about the impacts on Babylon, you know, setting up an APMS practice with some physical space, you know, in each CCG that they want to be present in. I'm not sure that that's actually that much of an ask for a company at that scale, or you know, approaching that scale. CCGs are huge areas. You know, having some physical presence in those areas may not be too much of an ask for them. So, in my opinion, I don't necessarily see this as too much of a challenge to their business model. What do you think, Andy?
I don't think it does. I think, you know, it definitely changes their model in terms of how they're having to offer services. And we know they are expanding, so they're looking at Birmingham. We know that they're potentially going to other places like Manchester and other cities and stuff anyway, because that's where I guess a lot of the density of their current patient load is. The interesting part about this, I think, is actually going to be more what happens once they've created those APMS practices, partly because I'm suspecting a lot of this has been driven by the network DES, because obviously NHS England want the network DES to work, so, you know, patients having care close to themselves in terms of providing care for the community, that kind of stuff. And, you know, if a company is down in London and they've got patients in Sheffield, they can't really do that if they have an APMS practice. So just for clarity for our listeners, an APMS practice is slightly different to a normal general practice. In fact, it's the contracting terms and stuff. But it effectively means they'll have a physical space in that area. But then, by the terms of the network DES, that practice will have to engage with this local area because they're now providing care, and so they'll have to integrate and work better with their neighbours. That's where I think it may get interesting, because at the moment Babylon with other companies unfortunately doesn't have the greatest name, you know, and this has caused a lot of conflict, it has caused a lot of strife, and there's definitely different views on how that works. But, you know, this will potentially open up the doors. Babylon will have to work with other practices, and other practices will have to work with Babylon GP at hand practices. And that's where I think it's going to get really interesting.
And everyone will hold hands and work together for the greater good of the patients, I guess.
Yeah. So I think that's the part to watch, because I think that's going to change the model. And we've seen different companies approach this differently. So we talked about Babylon. There's also other digital providers, Push Doctor, Livy, Q Doctor. You know, there's various other providers. But those companies seem to have taken a much more collaborative approach with working with practice. So Livy provides healthcare for various different areas as a back-end kind of service. Push Doctor has its own practice, but has also partnered up with other, particularly larger practices like Modality and that kind of stuff. And similar for Q Doctors, they're providing the back-end for a lot of practices who want to provide digital services. So those companies have taken a slightly different approach than Babylon, that prefers to seem to have this model where they take over or run the practices as such and then offer care. And that may be the change that's actually, like I said, it's going to be the more interesting one.
Yeah, that's a very interesting observation, Gandhi. The other observation I made was that I think this solves a funding problem for CCGs.
Yeah.
So I think really what prompted this was the situation that arose in London, where the practice where GP at hand was based attracted a huge number of new registrations and placed a lot of demand on that CCG, and there was a lot of transfer of patients and transfer of funding between the CCGs that made the financial position very challenging for some of the CCGs and very complicated. And this addresses those flows of patients across CCGs, because once another 1,000 are registered from one CCG and another, you've got to set up a new APMS contract in that CCG. What it doesn't address is some of the challenges and issues that individual practices and providers had with the model. So the sorts of problems with low demand, low cost patients, fit, healthy people, registering the digital first provider and sort of pulling away their funding, which does actually subsidise the care that other providers would still need to provide for the remaining higher challenge patients, so pregnant ladies, young patients, older patients. That problem can still arise within a CCG because CCGs are huge. So this solves a problem for CCGs. It doesn't really solve the disruptive effect that digital first providers like GP at hand might have on individual practices. I think that's a story for another day.
Definitely.
Maybe working within the networks might address that. I don't know.
I mean, I think it does give Babylon the option of being more engaged with offering that perceived level of complex care that I know many people feel they probably don't offer. And like you said, so there's probably the pregnant women, like the more complex patients and stuff, because of the fact the way their model works. This is obviously what people are thinking and saying. We're just reflecting that. But I think if they have local hubs, it allows them to potentially offer that. The key part comes with those APMS sites is whether they basically staff them with just AMPs and nurses, or whether they do have GP clinics as well. That's not to say that AMPs can't do things that GPs can't do, but there is a different level of complexity that comes into some of this, and there's always the patient perception element to this as well, which every practice is challenged to deal with.
So I hear you. So there's an opportunity for GP at hand or the digital first providers to step up and provide good care for the whole community. And that's a very worthy challenge, and hopefully they'll step up to that. I still think with their slick marketing and marketing budgets, they can still peel away those more those lower cost patients from other providers. So I still have an issue with that, but we will see.
So if you guys want to check out the article, we'll put the link to the article in the show notes. We've just had Andy's computer go to sleep.
So Gandhi, what story have you brought along today?
So the CQC have released a report looking at basically the barriers to digital adoption in healthcare, effectively, and it takes a look at some of the challenges that they've come across when they've spoken to people about using digital and that kind of thing within the healthcare model. It would come to no surprise to people that there's good and bad parts of this, I guess. The first thing is that they feel digital can have an impact on patient care significantly and to help improve it. And there's an unresounding element of it that they feel that will work. But they have, and I quite like this, they have actually recognised that there are challenges with this as well. I think one of the key ones they mentioned is cost. So that's a massive thing in terms of people paying for the services and the digital things. Someone has to, whether it's CCGs, whether it's practices, whether it's patients, people have to pay for it. And it's not cheap, because these things do cost money. But the second part, and probably more interesting one, is the apprehension of the use of the tech and the adoption of it itself is a key challenge, particularly based on scepticism that many people, like staff for example, have about, first of all, using the tech properly, so having the understanding the ability to use the tech, but more importantly, and this is what they seem to come out with currently through the article, interoperability and actually using it effectively.
It's got to work, hasn't it?
Yeah.
And that is too often people's first experience of technology in the NHS. It doesn't work, and then it really does switch people off.
It does. And it's those kind of things like, we see this often. We only get part of the picture of a patient because their notes may be kept in the hospital or maybe kept in another practice that doesn't integrate with our clinical system. And that's fundamental basics that don't work effectively. And lack of information then impacts your ability to offer effective care because you don't know the whole story. It's other parts of lots of people have gone off and created loads of really cool looking software or hardware things that you think works so cool to help patients with either particular health problems or general health problems, but none of it integrates with the systems that, for example, the GP may be using. So therefore we're having to use a different system to look at that, and it just makes it more of a barrier.
Yeah. Absolutely. So what are some of the other sort of issues identified within the report?
So they talk about a couple of other things. They definitely talk about how as well technology can have an impact on the patients themselves using it. So one thing they highlight quite clearly is about digital literacy of patients. So making sure that patients can actually use the tech effectively. So it's not just clinicians' apprehension, it's also patient apprehension. They do mention a couple of subgroups, so the elderly, which I think is potentially a stereotype at times. There's definitely some of our elderly patients that are much better at using these systems than some of our younger patients even.
Yeah, I think so. I think I might use the term very elderly because kind of older people are generally quite good with technology, I find. They come to the patient group, they're talking about the lack of online appointments and we should have more. So yeah, I think it's the very elderly and also...
And the learning disabled was a key characteristic they mentioned. So does providing tech or digital kind of first models or tech enabled models, does that impact those patients with learning disabilities who do or may struggle? I think there's also areas where tech can help those patients as well, because obviously it allows better visuals, easier visuals because you can make images rather than text, which often can help and stuff. And the interface doesn't have to be keyboard based. It's, we're seeing increased use of screens and that kind of stuff and making it easier. But there is still that recognition that there are definitely populations that will struggle. So therefore they're keen to mention that and make sure that's looked at. Let's try. Good. And then there's this other aspect of information sharing that seems to cause a lot of the anxiety that people have. And I wonder if a lot of this is in the wake of GDPR and the scary fines that people can be subjected to. Definitely from practices' point of view, I know many practices are always anxious about GDPR leaks and that kind of stuff. But even patients, I think, are becoming more aware of the fact of information sharing and stuff and how they want their information to be shared. And therefore that can create issues if it's not shared or it is shared. You need transparency around these issues as well, don't you? I think people are a lot more aware of information governance, even if they might not call it that, because of the controversies around Facebook and other big tech companies and what they've done with their data and leaks from from big organisations, often their databases hacked. Any take-home message? So I think what they mentioned quite clearly is that tech is here to stay, first of all. It can have clear benefits, both for clinician and for patient use. Definitely needs to be used sensibly. There are definitely concerns about how tech is used and interoperability being at the heart of a lot of this stuff, closely followed by information governance and sharing and that kind of thing. But recognising that digital literacy is a key aspect that all of us kind of need to be looking at. And I know there are people doing that. So locally we've got Connected Nottinghamshire, a really amazing group that we've had working with. So I guess that's a slight declaration from us. But they are looking at helping patients use tech more effectively and creating media, creating events to try and help patients register, like the NHS app.
And I think it's perhaps one of those areas where health perhaps needs to share responsibility with local government and so forth, because this digital literacy problem must be shared with other services, particularly social care services. So we perhaps need to band together with our colleagues in the council and social care to address that problem as well.
And I think practice needs to recognise this as well, because tech isn't going away, digital isn't going away. It's written within the long-term plan, it's written within the new contracts, the fact that you have to have 25% of your appointments available online now, and this has obviously increased the availability of online appointments, because it has to. But seeing this is going to be important, and this information is going to keep coming to us as well. Wearables is the next thing. I mean, we talk about in our recent episode, which you guys can go and have
you can download right now.
Exactly, how consumer wearables can have an impact on healthcare. We're going to see more of that, and I think we have to recognise that's going to be an impact. And so you can go off and have a look at the report if you want to. It is a bit more detailed and stuff, but effectively, I think the report is sensible. Shouldn't think coming from CQC, but I think it covers the key points.
Excellent, good. So that brings us to the next item. So tips. So we're each going to give you a tip. Now this section may be an app It may be something you can do, it might be a podcast, a book, it really could be anything. So tips and recommendations. Gandhi, I'm going to put you up first. What have you brought along for us today?
So guys, I'm going to talk to you about an interesting app I've been using for a while now. It's called LastPass. And this actually speaks to some of the challenges we've already spoken about.
Okay, good choice.
Yeah, so the reason why, as we mentioned earlier, GPs in particular, clinicians, whether you're working in healthcare, whatever, you have loads of logins. You know, numerous different services, whether it's your main clinical service, you know, EHR, electronic health record, or whether it's the one that you have to use to request your blood tests on, the one that you have to use to access your emails. If you're a clinical director, my God, that list will increase exponentially, particularly if you've got other roles. And if you are a portfolio working person, you know, having different roles in different sections, you'll have different logins for different, all this kind of stuff. LastPass fixes that. Okay. So it's basically
Tell me more.
So it's basically an app locker, and it's a vault where you can store all your passwords for various different sites and stuff, and it works. It's unbelievably secure. So I could go through the security credentials. To be honest, I've forgotten slightly, but it is bank level secure, if not more than that. So you know, they say that it shouldn't be hackable, and they pride themselves on their security. And you can even have parts of it that allow that to be even more secure. So you can have multifactorial authentication. So what that basically means is you can set it so that it will only unlock certain apps or things when you use them when you're in a particular geolocation. So for example, you can set it so that you will only be able to access the login for your computer when you're at the geo-tagged location of your computer.
Oh, okay.
Or you can have a separate one where it sends you things like text messages, or you know, a web link that you have to click on your phone that would obviously only be with yourself to try and work.
I like the geolocation feature. That's nice.
And it keeps your password. So it takes a tiny amount of setup. So each time you go to a website or go to a system on your computer, if you've got the last app working in the background, it will ask you, do you want to save this? So you click yes. You make sure you've got all the right details and stuff. And it does have the ability to put extra stuff if you want. So you can use it for banking data and that kind of thing. You know, all the various different passwords and stuff that we have. And then basically, it asks you every time you go to the website, do you want to use your LastPass to unlock it for you? And you click yes. If you want to, you can set it so you've got a master password for LastPass. So it can be something, you know, really complex but unique to you. So a lot of the people who use NHS email would realise that the way that you do your NHS email password has changed now. It's moving away from the 3 monthly rotations, and it has to have this number of characters and this kind of stuff. And now they're actually saying just have a really long word, typically 3 words that mean something to you put together, and that'll last a year, because they found that actually that's more secure. And it's easier to remember because it's relevant to you.
Relevant. Password 1. Please change your password. Password 2.
Yeah, exactly.
Password 3. So gets rid of all of that. So Gandhi, can I use this on my NHS computer in my office at work?
So depending on where you work, it'll be on obviously whether or not your NHS IT people allow you to put the software onto the computer. Yeah. It's normally browser based, so
it's like a browser extension.
It's a browser extension. So I'm a Chrome user, so I have the extension on my Chrome browser. Every website I go to, if I want to log in, it'll save it, it'll ask me, or have it on your phone. That's probably the easiest thing. So I've got mine on my phone. And the other benefit from having that, because a lot of phones nowadays have extra security measures like either Face ID or thumbprint, I can now access all my websites and stuff just by putting my thumbprint in, and that's unique to me. So I know it's secure, it's there, I don't have to keep worrying about remembering all these crazy, long, complex passwords.
And you can have stronger passwords.
You can have stronger passwords as well, so the security part of it is even better. It is free, this is the other thing. So it is free. It does have more functionality clearly if you pay for it, and to be honest, it's not the most expensive thing in the world. So you can have a year subscription for the individual thing, personal version one, which gives you the multifactorial authentication and stuff for about 30 quid a year, which is not horrific. You can also get family licenses, so if you want to pay for 6 people in your family, that's only an extra £10 a year. So it works out about £44 a year or something like that. I really like it, and I would highly recommend people to use it, purely simply because it takes away this pain of having to remember all these stupidly long, complex passwords, and it's always with me because it's in my phone. And if my app transfers to another phone, which I can do through Google and that kind of stuff, it's there as well. And technically, I now only need to remember one password that is very unique and very complex, but fine for me. So yeah,
Cool.
that's my tip.
Okay, excellent. So,
Yeah.
I've got a tip for you.
Go.
It's not an app. It's a podcast. It's another podcast, just like us. And in particular, it's a podcast episode. So I've been getting into, I listened to some interesting, perhaps strange things. Harvard Business Review podcast. I've been listening to it. And this particular episode is episode 701.
Mm-hmm.
Okay, and this episode is about focus and distraction.
Mm-hmm.
And this is something that I struggle with. I think maybe everybody struggles with this in the 21st century because
Mm-hmm.
there's so many notifications and different things that you can do in your pocket on your phone.
Yeah.
It's difficult to focus on tasks, isn't it? And
Yeah.
the argument goes that this is making us all less productive.
Mm-hmm.
So they have a guest on this episode, and the guest is actually, it's a guy called Nir Eyal.
Mhm.
I think I've got his name right. And he wrote the book that has been used by many tech entrepreneurs when they've been setting up their companies and developing their addictive products,
Mhm.
which are designed to steal and capture and hold your attention. So he first wrote a book called How to Build Habit-Forming Products.
Yeah.
And now he's sort of switched sides and he's written Indistractable, How to Control Your Attention and Choose Life.
Yeah.
So, and that might be why he was on the podcast this time, because he happens to have this new book coming out. But nonetheless, really interesting interview with him. They talk a lot about distraction focus, how these products work, and how you can hack back and sort of get around it and regain control over your focus and attention. I'll give you 4 tips from the podcast, so you've got something to go away with and you can see if you want to go and listen to this episode or not. So tip number 1 was manage distraction.
Mm-hmm.
Okay, some of these are obvious, some of them are better. Simple tips, and if you're there, you want to check your your Facebook, see if anybody's been on the eGP Learning Forum, for example, Gandhi, and you've got that itch. It says, right, you don't have to never do it. Just if you want to do it, just wait 5 or 10 minutes. So it says just delay. Don't succumb, delay. And if you still want to look at it in 5 or 10 minutes, then go ahead and look at it. But just postpone that initial thing, and that should stop you going down the rabbit hole so much. Nice tip. Tip 2 is around the opposite of distraction. So Gandhi, what's the opposite of distraction?
Focus.
So the way he was saying, it is traction.
Okay.
It is doing things effectively, is the opposite of distraction. Although I thought focus too at first. So it's make time for traction. That's what he says. So, and you talked about some of this in your recent episode, which I'm sure we can link to, and you can look at about how to be effective and productive. But he says have a schedule and make sure that you schedule the important things and schedule what you need to get done. A to-do list is not sufficient. A to-do list is just a list of things that you might never get around to doing, and it's unmanageable because they become huge. So it's actually have a to-do list, but then actually schedule it for the day that's coming up, for the week, so you've actually got time to do what's important and focus on what's going to have an impact in your life. Hack back against the triggers.
Yeah.
So what he says is these companies who design these apps and services put a lot of thought into how they can get your attention, keep your attention, because that's what's valuable to them, and they can advertise to you. That's behind a lot of their business models. So the simple thing is just turn notifications off. So he was involved in the development of the concept of notifications. They're basically there to stop you doing what you're actually doing that you should be doing and pull you into the app or the ecosystem. And the tip is just switch them off.
Yeah.
And if it's important to you, you'll go and check. So
Definitely. And I actually exemplify that. So some of our listeners will know that I also run this S1 Facebook users group. And I did a video about changing your user preferences on System 1, because actually a lot of people don't do that. So one of the main clinical systems that we use in primary care, and you get tons of notifications for everything. And actually, my little hack that I do for every trainee that comes to me, every new member of practice, I sit them down and I go through it with them, and I simply just say, this is the notification, which ones do you want to still get? So
I've got a question, and every System 1 user will understand this problem. So you type in the notes. You're not a touch typist, so you look at the keyboard as you type, and somebody sends you an urgent notification to you or just to the group that you're in, and it it pops up a thing that says, "Oh, an urgent notification has been received," and then it interrupts. So you might have typed another few sentences without looking up at the screen, but this thing's popped up and it's not going in the computer, and it's really frustrating. Can I turn that off?
You can.
Okay, go to System 1 user group to find out, but you can. Right, I'm going to go and find out and do that.
Definitely.
Right, Gandhi, I want to ask you a question now about the System 1 notification preferences.
Okay.
I think anybody who uses System 1, that's our GP record system, that's popular in Nottingham and across the country. So, happens a lot. So you're typing your patient notes in, you've got a lot to say, you're not a touch typist, so you kind of, you're looking at your fingers as you're typing, and somebody sends an urgent task to you, or to the group that you're in, maybe just to the doctor's group or the clinician's group, and a box flashes up, and you don't see it because you're typing, you carry on typing, you might have typed a few more sentences, but none of it's going to the computer because this box has popped up on the screen. Can you switch that off?
So you can switch off the ability to get that notification for that group, so you can do that. You can change it so that when you get notification it pings a sound, so that you're aware that that's happened, and therefore you know, oh, I've had a sound, I need to check my screen, and therefore that's why. But that unfortunately is for all notifications in that area then, so it's all or nothing. You can't unfortunately set it so that you can keep typing because the notification is there. They have changed that for IM messaging, so before you could do that with IM messaging, but for notifications and for tasks, unfortunately, notifications is dead easy, just switch them all off. That's what I do. I don't have any urgent notifications because my general view is if somebody needs me, they will call me. So as I talk about in my improving productivity, have one route for people to contact you and stuff. But for tasks, again, you just change the type of tasks that get notified to you.
I think I might switch off all the notifications.
Yeah. I think it's worth keeping in mind that if you've got practice agreements of how you run certain things, that just check with those. But yeah, for me, to be honest, I switch them all off. And then you just make sure you've got points in the day that you're checking them. As long as you do that, you're fine and you're covered.
Yeah, you just got to make sure you check for those urgent tasks.
To have that timetabled into your list.
You schedule, hack back to triggers. I know that was time for distraction, wasn't it?
Yeah.
Tip 2. And the final thing, so I really like this. So it says prevent distraction with packs. So make agreements with yourselves and those around you to prevent distractions. And the example that he gives is get one of those, the electricity timer plugs that you, in the days before smart homes, we used to put the lights on a timer to give the impression that we're in. Get one of those and put it on your Wi-Fi hub and have an agreement that after 10 at night in your house, the Wi-Fi goes off and nobody can use their internet devices. Unless you've got 4G, I suppose, then you get around it. But I really like that idea. I thought that was quite fun.
Yeah.
And I've not put it into practice though.
But there are different ways you can use it. There are apps you can use that stop you being able to use other kind of apps and stuff at times of the day. There are different ways you can set your phone so you've got do not disturb so you don't get anything. I think some people will always feel a little bit anxious about having at least one method of communication, so I tend to keep my phone on no matter what. But you can switch off the data. Go airplane mode and then just have the cellular calls only.
Actually, the do not disturb functions are pretty good on phones as well. But I just liked the kind of the brutal on-off of the Wi-Fi hub using an old-fashioned timer. I was attracted by that. So that's it. Anyway, so that was a great podcast that I listened to. Really enjoyed it. It's really entertaining. So just like to recommend that to you guys.
I'm going to put a side mention to that. So I've listened to basically the same guy on a different podcast.
Recommend
this one. And this is one that many of our listeners will know that I like listening to. So Pat Flynn, he was on Pat Flynn's podcast about a month or so ago as well.
And who else has been on Pat Flynn's podcast, Gandhi?
Since you mentioned it, as many of our listeners hopefully know, I'm really proud of this. I managed to get on Pat Flynn's podcast as well. So he's a massive mentor to me, and possibly even the word idol probably I'd use. He's helped me and others, to be fair, with a lot of the stuff that he's taught, figure out how to do podcasting and that kind of thing, and all the other stuff that comes with it. And I was really lucky I got to be on his coaching episode last week, so episode 1089, and I talk about my journey of doing EGP learning and that kind of stuff, and how to basically do more with very limited time that I have. You know, GP trainer, clinical director.
It was a really great episode, and there are some really good tips that I think anybody who is working in healthcare and wants more time to do other things could definitely take away. So yeah, we recommend Pat Flynn's Ask Pat 1089 with Dr. Hussain Gandhi.
But as you mentioned, so the indistractable guy, I've forgotten his name now.
Nir Eyal.
Nir Eyal. He was on the other podcast that Pat does, which is the Smart Passive Income one.
Yeah.
And again, that was at the beginning of September, I think it was the episode then. I can't remember the episode number, but yeah, similar sorts of things. He talks about his 4 hacks and stuff, and the book. I've had a brief look at it. I struggled to get into it a little bit, if I'm being honest. But
I've not looked at it. It's the podcast I'm recommending, but if you're interested, try the book. Cool.
So guys, that's our new format. So we, a couple of articles that we wanted to cover in terms of health tech and that kind of thing, and then we're going to give you our tips and stuff. We are going to come back to you with some more deeper dive ones, and we've got a really interesting one on productivity that you do not want to miss, because it's going to tackle that really annoying thing that is email.
Yeah, that really high-tech, cutting-edge, bleeding-edge technology of email.
Yeah.
But it does cause a lot of...
Yeah, so we're going to give you our tips of how we manage emails, which sometimes works and
sometimes doesn't.
May not do, but we hope that by listening and engaging with it, you guys will find the journey a bit easier. We'd definitely be keen to hear your tips when it comes to managing email after that and stuff as well. As always, if you want to contact us, we're available on all of our different platforms, so Facebook, Instagram, YouTube, LinkedIn, Twitter, definitely for both of us and stuff. And obviously on our podcasting platforms as well, so it's on iTunes, Google Podcasts, Spotify.
You're probably watching this on YouTube if you're watching.
Yeah.
So leave a comment.
If you are, first and foremost, make sure you subscribe so you get all of our content. We really would like you to make sure you get all this first and then straight away. We know our releases for this particular part have not been as great, and we're going to get on top of that for you guys now that our PCN stuff has calmed down with the team.
Yeah, it's rolling now.
Yeah.
It's rolling.
And also leave a comment, because we love it. We really like to hear from you guys, and we will give you a shout out when we get your comments and stuff, whether it's on Twitter or all the kind of things.
And give us some feedback about the new format as well. Have we got the length right? Are the topics right? So we'd appreciate your feedback. You can help shape us, and we'll deliver more of what the health technology community needs.
Yeah, and interesting as well, for those of you Nottingham based, we are starting our own health tech community. So we're going to basically have this up and running. Our first meetup will be the 12th of December in Nottingham City Centre, at a place called Antenna. We'll put some links to the site and stuff down in the show notes as well. We would encourage you to come and join us if you are Nottingham based. We may even try and figure out things like streaming and all that kind of stuff on the day, pending how we get it up and running. And
watch this space.
Yeah, so that's hopefully something we're going to look at. But in the first support, we're looking at basically creating a Nottingham-based community of health innovation and things. So if you guys are Nottingham-based, get in contact with us. We'd love to hear what you think about this idea and taking it forward for you.
Yeah, very exciting times.
Yeah, we're looking forward to this for you.
Good. So I guess that's a wrap. Thanks for listening.
Yeah.
Again, we hope you enjoyed the new format. Give us some feedback, connect, communicate with ourselves and with each other in the health technology community.
And we'll catch you soon.
Right, so it's goodbye from me.
See you in the next episode, and goodbye from me.